What's up, Jimmy? Today we're going to be talking about colchicine. So colchicine is a medication that we're going to use for treating acute gout flare, similar to allopurinol or Provensid. Okay, if you don't know what allopurinol or Provensid is yet, you can watch those videos after, but just stay with me. Colchicine is the one that we're talking about now, and I'm also going to give you some hints about the other ones, so don't worry about it. Alright, so colchicine is an anti-gout medication, but it's not a uric acid lowering drug. Okay, so stay with me. Let me explain. Gout, as you might know, Jimmy, this is crystals. Uric acid crystals that start accumulating in the big toe. Those crystals are not normal in the body, and especially in that place. So the body is gonna see that, it's gonna react, sending neutrophils. All right, so they're gonna move to the crystals and they're gonna produce inflammation. What do you get with inflammation? Pain. So pretty much the body is trying to eliminate that, but by trying to do that, it's causing you a lot of inflammation and pain. So this big toe is gonna get swollen, and that's what we see the gout. That's how you see the gout. Now, colchicine, what it's gonna do is that it's gonna block the neutrophil migration and inflammatory response. So we are not destroying the crystal, sorry. We are not fixing the root, but at least we are reducing the arrival of neutrophils, and with that, we're reducing inflammation and pain. Sounds good, right? So we're treating inflammation and pain. We're not treating the cause. We're not lowering the uric acid levels. All right. So if there is something that you should remember from this video is colchicine is for acute gout flare or acute treatment. Like the patient start having the flare up. What the flare up means, the neutrophils are just arriving there, are going to start creating inflammation. That's the moment that you want to take colchicine. Because as I said, colchicine, we are lowering the probability of more neutrophils arriving there. So when do you want to do that? In the beginning, right? Before they arrive and do the inflammation. So usually a dose will be of 1.2 milligrams, and then they will add 0.6 milligrams 1 hour later, and in total, in the first day, the patient will be receiving then 1.8 milligrams. Sounds small, right? Then just remember that. Why do you think that is? This medication has a high risk for toxicity, GI upset, diarrhea. So again, we just get at the end of the day 1.8 milligrams, 1.2 first, and 1 hour after 0.6. Now, there's other medications for anti-inflammatory options. We have NSAIDs or steroids or colchicine. You can use any of those, but for the flare-ups of gout, ideally colchicine. Okay? Now, for maintenance, let's say the patient has gout chronically, so for maintenance, we're gonna be allopurinol and Provensid. Allopurinol is just gonna lower uric acid production. So less production, less crystals arriving to the gout. Provensid will be increasing the uric acid excretion. So allopurinol lowers the production. Provensid increases the excretion of my fingers are here. And number three is colchicine is just gonna be reducing the inflammation. It's gonna be acting in the flare-up by lowering the inflammation. We're not treating any crystals with colchicine, okay? All right, so Jimmy, the most common colchicine adverse effects are gastrointestinals. So that will be diarrhea, nausea, vomiting, abdominal pain. So do not treat severe diarrhea as just a harmless side effect. With colchicine, significant GI symptoms can be early signs of toxicity. So the nurse should notify the provider if the patient develops severe diarrhea, vomiting, dehydration, or any worsening of abdominal symptoms. So toxicity can become serious. Now, colchicine can cause also bone marrow suppression, which may show up as low white blood cells, low platelets, or anemia. So this is why complete blood count monitoring matters. Okay, especially for patients taking it longer term or patient at a higher risk. Also, it can cause neuromuscular toxicity and something called rhabdomyolysis. So you have to watch for muscle pain, muscle weakness, dark urine, elevated creatine kinase (CK) or creatine kinase, or worsening renal function. The risk tends to be higher in older adults, and patients with kidney dysfunction, as in many medications. So, and also in patients taking other myotoxic or muscle toxic drugs like statins or fibrates. Now, when it comes to renal or hepatic function, they matter because impaired clearance will increase what? The accumulation, and with that increases the risk for toxicity. So before and during therapy, you have to review bone, creatinine, liver enzymes, complete blood count, and the full medication list that the patient is taking. So final recap. Number one, colchicine is for acute gout, and they don't prevent the crystals from forming. They don't destroy the crystals. They just lower the inflammation. How? Number two, they block neutrophil inflammation. And number three, safety checks. You have to check what medication list the patient is taking. You have to check the labs, renal function, liver function, complete blood count, any muscle symptoms. And something extra, usually you want to avoid any grapefruit products, and also any CYP3A4 or PGP inhibitors, okay, because all of that is going to increase risk for toxicity, GI upset, myopathy, bone marrow suppression, you know. So hope this video helped you guys. Leave a comment below if you want to know, if you want another video about another topic and you haven't found it on the channel yet. Subscribe, and thank you. Have a good one. Enjoy.